I'm going to share my screen here. So my name is Becky Sanders. I'm the Program Director for the Upper Midwest Telehealth Resource Center. And today we're going to do a little introduction to the Upper Midwest Telehealth Resource Center. So our resource center is a regional resource center. We cover the lilac states on the map: Illinois, Indiana, Michigan, and Ohio. And we're one of 12 regional telehealth resource centers around the country. There are also 2 national telehealth resource centers, one for policy and one for technology. And together, the 14 of us have formed the National Consortium of Telehealth Resource Centers. Our federal funding from HRSA under the Office for Advancement of Telehealth, that program has been around since 2006. The UMTRC has been a regional telehealth resource center since 2011, and I've been the program director since 2012. We do have a national website with the National Consortium of Telehealth Resource Centers, and they run a monthly webinar series and a telehealth hack series. So go ahead and check out their website. Some of the most referenced resources from each of the 14 websites are also posted there, and there's an interactive map that you can reach out to any of the 14 of us. Here on a regional basis in our region, we consider ourselves virtual librarians, especially with COVID-19 and the pandemic. Most of the outreach that we do is virtual. We receive emails through our website or through the national website or from previous contacts or calls over the phone, and we answer those individual questions, and we consider those technical assistance. So the resources that we create and the one-on-one interactions that we have are really the bread and butter of our program. We also do connections with other programs to learn best practices, project assessments, and provide updates on reimbursement and legislative developments. There are presentations that we do, like today. We do this is one of our virtual office hours. We also have a webinar series, and we do a podcast called A Virtual View that you can find on your favorite podcast platform. We also do telehealth workshops and trainings, and we're working on getting our demo center up and ready. So telehealth versus telemedicine. Telehealth is the broader field or the broader term that also encompasses distance learning and education. Billable services.
To discuss the questions that I had. Is this an okay time for that?
Yeah, absolutely. Go ahead, you have a question? Okay. So telehealth versus telemedicine. Telehealth, as I said, is the broader field encompassing education, and telemedicine is that billable and clinical encounter between a patient and a provider when they are not in the same location. Additionally, the terms around virtual visits and video visits and e-health and m-health are starting to change, especially with COVID. We often hear the word telehealth more than telemedicine, and we hear the term virtual visit or virtual care much more in our common everyday language. I also want to emphasize that when we talk about telehealth, we're not talking about a specific clinical service. We're talking about a delivery modality to bridge the distance between a patient and a provider. There are 2 types of telemedicine. There's store and forward telemedicine, which is asynchronous telemedicine, which is often used for dermatology or transferring of data. And then there's synchronous telemedicine, where that's a 2-way audio-visual connection on a HIPAA-compliant platform. So with the adoption of telehealth, when we were first getting our feet wet as a regional telehealth resource center, there was not a lot of interest in telehealth, and we really had to promote it and be champions of telehealth. Well, in 2020, along came a world pandemic known as COVID-19, and that really changed the scope of what we do and the number of organizations and individuals that we work with. So now it's kind of like we're driving a cruise ship, and there's not enough berths for the people. We are been very busy with COVID-19 and helping new organizations to get started and integrating telehealth into their organizations. So as we put this together for a recent report for our funder, HRSA, and gives a good graphic showing how back in 2017 that we only had 90 technical assistance events, and that increased over the prior year. I'm sorry, we had 175 events, and there was an increase of over 90 from the previous year. And then you can see as the years go on that the increase from the previous years have increased exponentially in 2020 with COVID-19. Another infographic that we've put together that really emphasizes the amount of work that we've done and the effect COVID had on our work. You can see this spike here in TA recipients and events in the March and April timeframe of 2020. And while things have gotten a lot calmer for us, we're still at levels that are higher than the previous year. One resource or database that you can look to for information on telehealth and the variety of claims and the number of claims in comparison to pre-COVID is fairhealth.org. And you can run this report either as a region or as a national report, and it gives you volume of claims from year over year. So this one is from March 2020, looking back at March 2019, and you can see that the percentage change in claims was 2,841% greater in 2020 than it was in 2019. Also, you can see the top 5 codes, the billing codes, those HCPCS and CPT codes. There is some similarity in those codes year over year. And also you see that both years, March of 2019 and March of 2020, mental health conditions is the highest usage area of telehealth. And you can also see a comparison urban versus rural in the population using telehealth. And then here we're looking at a report, same information, but looking at a national level, and it does change just a little bit. Here there's an increase of 4,346% from March of 2020 to March of 2019. Some additional national data about telemedicine visits per week, and this is looking at specific states and all of the telehealth resource centers around the country. You can see that the Northeast has the majority in comparison to other regions of telemedicine visits per week. And here, when you talk about total TA recipients, you can see that that number has grown exponentially over our technical assistance events and outreach events and COVID-19 requests. So one of the things that we get asked about a lot is the public health emergency and how long it will last, and what does that mean for reimbursement of telehealth. So right now, the current public health emergency that we are under, that order, was released in January of 2021, and it extends through April of 2021. That was done by previous Secretary Alex Azar under the Trump administration. Now, the Biden administration has said that their intent is to extend the public health emergency through the end of 2021, but they haven't actually done that yet. And just yesterday, President Biden addressed the nation and was talking about the shots for COVID, those vaccinations, that he wanted all ages to be available to get vaccinations in every state by May 1st of 2021, and that he thought that July 4th of 2021 would be a huge victory for the United States, where things might start relaxing and we'd be kind of over the hump of the COVID-19 pandemic. Here at the UMTRC, we have put together many resources around COVID-19, and this is a screen grab from our website at umtrc.org. And you can see we have various references, and we've categorized them by state. So on those pages, you can see all of the executive orders that were released by each state. And you can also link out to the Medicare resources on a national level. One of the most asked questions, one of the questions that we get the most often is regarding reimbursement and billing. So this particular screen grab from our website shows you some of the billing resources that we have available. And again, they're broken out by state. Medicare is the same across the nation, but each state Medicaid program is a little bit unique in and of itself. And each state has their own laws about commercial payers and private insurance. What's the future of telehealth? Well, that's a great question. Two of my favorite quotes about the pandemic, one from Seema Verma, former CMS administrator, said that the genie is out of the bottle. And a policy director from the National Rural Health Association said the toothpaste is out of the tube. So it's very difficult to go backwards when either one of those situations. We think that the future for telehealth is very bright, and it will become much more common in the future for all types of care. Some additional ways that you can reach out to us. So obviously, I've already talked about our website at umtrc.org. We also have a Facebook page and a LinkedIn page that you can reach out to us. And we do have a monthly newsletter. Our newsletter comes out typically the beginning of each month. And if you go to this page on our website, you can sign up to receive future newsletters. With that, I will take any questions. Questions can be entered through the chat, or you can unmute yourself and ask a question. All right, well, hearing no questions, we'll go ahead and end today's session. Carolyn, can you go ahead and put the link to the survey in the chat? And thanks for joining us today. Have a great weekend.